Bonjour, greetings everyone. Thank you for joining. I wanted to provide an update further to our meeting on September the 12th. It had to do with drugs in our community and what our plan was to address it, which is why the community was invited. It was important for us not to politicize the event. We wanted to bring in everyone. The invitation was extended to everyone in the community, regardless of what political affiliation you were, what organization you're with. And it was important that all our directors were in the meeting as well. We felt that they play a key role in terms of how we will address the drugs in our community. Overall, it was a good meeting. It was a very respectful meeting. There was good dialogue. Some really meaningful strategies were brought forward, some ideas around what we can do. So overall, it was a good meeting. The bottom line for us as a chief and council is what does the community want? What would you like to see in terms of the steps we would take to address the drugs in our community? We had several meetings, and from that very first meeting, a phrase was shared with us, and we really tried to follow that. The community will endorse, and the council, chief and council will enforce, is a very good phrase for us to live by in terms of how we address the drugs in our community. So it's really the ideas that come from the community. You bring those strategies, those ideas forward, and as a chief and council, it's up to us to find what policies or bylaws need to be developed, keeping in mind that there are legalities, there are constitutional rights, so it's important that we work around some of those things as we move forward. There's been a lot of work since April, and I could not hope to provide you a complete summary of all those things, so I will just touch on a few of those things in this update, and eventually we will have a report coming out to community, and we will have more meetings as we move forward. So on April the 16th, we had our very first meeting with the different entities, I guess, the Sun Lodge, Matutu Lake, the Rainbow Lodge, the Health Center, the Healing Center, the wellness team. We had different members from the churches involved in the meeting, and again, it was important that that all these individuals, these entities, come together, because we are all affected by the drugs in our community, and there's no one answer, one good answer. So we brought them together, and part of what we discussed during that meeting was the importance of a community needs assessment, and this was to identify the specific challenges and gaps in the existing services we have that addresses drugs. The importance of resource mobilization, so exploring the funding opportunities and partnerships that we could use to support the implementation of a drug strategy. Also capacity building, so investing in our community, investing in our community members to empower our members and our organizations to effectively respond to the drug-related challenges that we face. We also discussed things like public awareness campaigns, the importance of collaborative partnerships, peer support programs. And I'm just going to go through the list here. Policy advocacy, the importance of organizing a public forum, such as what we did last Thursday. The importance of setting the right tone as we move forward in our efforts. So the messaging is really important, and the messaging in our band meetings are really important. Offering support and assistance to those that might be struggling with addiction. It's important for us not just to push them aside and throw them away, but offer them the support that they need, because it's our belief that people just don't do drugs for the sake of doing drugs. They're feeling some type of pain, what have you, and it's important for us to support them if we want to bring them back into and welcome them back into the community. We talked about addressing the employment opportunities. I know that in recent years there hasn't been much employment in the community. We've tried to address those, since coming on 16 months ago, raising the rate of pay for our teachers, for our band employees. This is all really important in terms of our people having a good life. And prioritizing family support was another area we discussed. Establishing a community circle of care, workshop and collaboration meetings, home visits, visiting our members in their home. Whether you're addicted or not, it's important for us to hear from you. And building relationships and having long-term commitment, because drugs are not going to go away overnight. We were reminded at Thursday's meeting that drugs were here years before many of you were even born. They're still here, and they may still be here another 20 years' time. But the important thing for us is to try. We have to put in the effort. We also talked about the exploration of treatment options, long-term recovery programs, and some really fine concrete recommendations, I guess, has to do with radio ad messaging, drug and alcohol addiction events, highlighting those individuals that may have struggled with drugs and alcohol in the past, maybe having something like a candlelight event or a walk. Creating support groups for parents and grandparents, I think, is another important thing. So this was followed up by another meeting on June the 12th. And from June the 12th to last Thursday, a lot of work was being done. You may have heard that there was a protest earlier on in the week. Our meeting on Thursday wasn't a reaction to that. All it did was simply move up a meeting that had been planned for a later date. But from the protest and from the texts and phone calls that we've been getting from community members, they wanted that meeting to happen right away, so that's what we've done. So in June the 12th, our COO and CAO and a few of the council members met with different community organizations, and they also discussed some treatment options, some helping options, I guess, for our people that might be addicted to drugs or affected by drugs in some way, whether a family member or a friend uses, a partner. So this was a well-rounded discussion. They talked about the importance of land-based healing approaches. I think given our disconnection from the land through our generations, it's important we move back to that, because it's through the land that we gain a sense of identity. So really, who are we? And it's our land and our language that really provide us with that insight. They also talked about drug prevention and control, things like drug testing, public posting of drug dealers, annual random drug testing. And you may have heard at the meeting Thursday that our HR are going to be moving quickly in drug testing all employees. And Chief and Council, as they indicated, we tested once, we'll do it again, we'll be the first in line. Also, things like community empowerment and wellness were really important, so using the community radio, strategic planning for drug uses, so having a 1, 2, 5, and 10-year strategic plan to address it, because I mentioned that drugs are not going to go away in the next few days, the next few years. The importance of establishing a crisis team was another idea. There was also discussion on the supports for addicts and recovery, youth engagement and safety, law enforcement and community safety, building infrastructure for recovery. So having things like a detox center, those land-based activities, treatment centers, psychological support, youth and wellness, family support, youth wellness and family support rather. Then that was further broken down into, what can be some of our more immediate actions, what are our long-term goals. And we have not formalized this by any means in terms of a strategic plan. So right now we are simply taking all the the ideas that are coming from community. Again, community will endorse, chief and council will enforce. So our immediate action items are to initiate roadblocks and surveillance. That was a heavy topic on, or I should say that was a topic that was brought up at the last meeting on Thursday. Crisis team establishment, banishing the drug dealers, community healing events and community celebrations, launch community awareness and effective community awareness campaigns. Some of our long-term goals, I mentioned, is the 1, 2, 5, and 10-year strategic plan. So always going back and revisiting, seeing how we can refine, fine-tune our strategic plan. Youth engagement programs, ongoing community education, I think, is a big one. And we have to look at the school, starting in the schools. It's our young ones that are being affected, and their safety a lot of times is called into question because of the drug use in our community. Finally, at Thursday's meeting, our COO and our COO handed out some items, I guess, that were discussed on September the 9th. And again, we'll have this compiled in the form of a report. But just some of these things was the importance of a community safety planning committee. It was mentioned that the core group has been established, and that group will explore and develop a safety plan for community, along with possible funding opportunities supported through Public Safety Canada. We also made a visit to Norway House. There was consultation with the Norway House chief and council, more so their community people, the ones that work in the different entities. So there was some discussion around the bylaw program, a review of the surveillance program. Other things include the addition of a new wellness patrol team. So there's a posting that went out for 6 staff, and this staff will patrol areas of concern identified by community, high concern areas. There's a need for additional lighting for high traffic areas, meetings with surrounding communities. So we are planning a drug awareness summit with Fisher River and Kinanjishtigan. They too are affected by the same issues that we face as a community. And I think it's important, given our proximity, given our relationships that exist between communities, it's important we come together and we do a more global effort, I guess, in terms of trying to address the issues that face our community. There's talk of harm reduction meetings. So recognizing that health will lead the meetings in this area for harm reduction implementation. And I think on last meeting on the 12th, there was a mention of a harm reduction meeting that was happening. I believe it was the following day. Signage for community. Very soon you will see signs coming up at the entrances of our community. And right now we're reviewing the quotes for the community awareness campaign, and we're also looking at the signage. So there are many, many things that we have undertaken as a chief and council. We haven't been sitting back doing nothing. But our engagement now with community, with the surrounding communities, will take it to the next level. I mentioned at the drug meeting on Thursday that we will take all of those ideas that were brought forward on Thursday. We'll develop questions from there, and we really want to take those back to community, because from there we'll develop some practical solutions to this drug issue. So that's another step we will take, and community, of course, will be informed. There will be advance notice of all these meetings. So with that, thank you again for joining, for taking time out of your day, and I appreciate that. And on behalf of Chief and Council, thank you. Miigwech.